for kids carrying heavy bags off to school, and it happens every year. They go back and they look like they've got more books in there than ever, and there's all sorts of things can carry all of them at one go and so on. And yet, no matter how we twist it, no matter how we do it, it seems they're heading off every day with really heavy school bags. Does this genuinely cause back pain, or just as parents do we look on and we look concerned, and that really they're just fine? Is it just us that's been overly worried? Well, physio Johnny Loughrey of JT Physio joins us now, and we're streaming live as well on Facebook and YouTube. Johnny, good afternoon to you.
Afternoon. Thanks for having me on, John.
Now, school bags, an issue, heavy school bags, it's an issue that comes up every year. And this is across the board. It's not just secondary schools, but it's also in primary schools. And should we be concerned?
Well, it's an area that they've been looking, a lot into, and there was a huge lit review done last year that was analysing kind of the ins and outs of it. And then one of the world's leading experts in back pain, Kieran O'Sullivan, did a lecture on it afterwards, and basically they were finding that a heavy school bag in itself won't necessarily cause back pain. So there's not a direct link in terms of if a child that is fit and healthy and has no underlying issues carries a heavy school bag, it won't necessarily cause back pain.
Okay.
What ends up happening is, in a lot of circumstances, there are other factors that might be there, and underlying issues that would cause back pain anyway, and that a heavier school bag then can obviously exacerbate these a little bit, and that's what we're finding.
Okay, so it's if the child is fit and healthy, a heavy school bag shouldn't be concerned. However, if there's underlying issues, maybe they've got slight back problem already, maybe they're very unfit or just unhealthy in some other way, carrying a heavy bag is going to make things worse. Is that it?
Yeah, and I mean, just to highlight as well, back pain in adolescence is very, very common. Some of the studies would show that between 7 and 58% of people between the ages of 10 and 18 will have some sort of back or neck pain within the period of a year. And there was another good study done, released in America as well. It was showing that up to a third of teenagers had a bout of back pain, in any given year. So different things that can cause that. Physical fitness is the biggest one, John. So I know we kind of harp on all the time about how much exercise kids should be getting, but it's hugely important that we're getting enough exercise and aerobic exercise, getting our heart and lungs fit, but also getting the musculature fit and strong as well. So exercise is hugely important. Diet is very, very important. We know the link there that mental health has, and increased levels of stress can influence back pain hugely. So I always find that in the clinic, coming up to exam time, you might get more kids coming in with back time or back pain if they're worried or stressed about exams. And the other interesting factor, obviously you've got growing pains as well, but one of the very interesting factors is that if you have a child or a parent that's very anxious about the weight of a school bag, it was actually shown to be a predictor of back pain as well. So somebody that's very stressed about, thinking a lot about carrying a heavier bag, they were more prone to getting a little bit of pain as well.
So it's like reflective pain. If parents really worried about their wee one going out with a heavy bag, that can be reflected in how the child feels.
Yeah.
Is it not a case of there's an awful lot of kids anymore sort of lying around far more than they should on devices, and that's, I know you mentioned their overall health, and I suppose it's all intertwined.
Yeah, hugely. So I mean, the Centers for Disease Control and Prevention just would recommend 60 minutes of moderate to vigorous exercise, so that kids are out running and exercising and playing and doing things. And you were rightly saying there that I suppose as technology has grown over the years, people are playing video games a little bit more and maybe sitting on their iPhones and iPads and laptops in the evening. So just encouraging kids to get out and exercising and playing sport and keeping fit and strong and healthy is really the key. So you'll find that if a child is kind of, I suppose, a little bit fitter and a little bit stronger, carrying a school bag is a lot easier for them.
Okay, so we shouldn't be overly concerned about the weight of the school bag within reason, but we should be concerned about the amount of activity that our our children are doing and about how healthy they are. I suppose keep an eye on their diet and just the amount of exercise they're getting.
Yes, looking at the bigger pieces of the puzzle. So getting enough exercise, making sure that the diet is good and that the child is a nice kind of healthy weight. And I suppose keeping fit and strong and healthy, and looking at trying to identify if the child is maybe under stress or anxiety as well. And like we were saying, one of the variables we can't control is growing pains. So if a child is going through a growth spurt, obviously that might predispose them to a bit of back pain, in which case carrying a heavier bag if they're going through a growth spurt can flare up the pain a little bit as well. So yeah, it's looking at the big pieces of the puzzle and just, I suppose, trying to control the variables we can control. So the exercise, diet, stress levels, anxiety, and then just factoring in, where there might be other issues. We can't rule out things like a scoliosis or things. So obviously, if you do have back pain and are concerned about it, just to go to your GP or your physio and have a checkup, and they'll be able to rule out anything else as well. Yeah,
like a lot of issues, it's not just one factor; it can be a combination of. And are there things that we can do to make life easier? Are there any types of bags that are better than others?
Yeah, I think the important thing to note as well is, I suppose, there's no correlation between how expensive a bag is and the likelihood of you getting back pain as well. I think the key is getting a bag that is very comfortable and fits the child well. What we would recommend is maybe one with double straps around the shoulders, so that we know that a mono strap or a strap that goes diagonally across the chest can inhibit the chest and respiratory system, so it can influence breathing sometimes. So just one either side of the shoulders that's nice and comfortable and fits the child well is perfect.
Well, back pain, obviously not a preserve of the young. And there's a text here that says, for a person with a bulging disc that is degenerative and with a long wait ahead for any medical interventions, what's the best way to relieve pain and maybe build strength around the back safely?
I suppose you would have to really assess and see kind of what they're able for and what sort of level they're at the minute. But what we do know is that appropriate exercise is key, so that if we have an issue with a disc there that needs a bit of attention, finding out exactly how much we can do and then trying to get a little bit fitter and a little bit stronger and a little bit more mobile with that underlying disc issue is very, very important. And we know even that up to 3 times a week of aerobic activity, so exercise, even just light cycling on a bike or on a stationary bike or walking, can help to relieve pain. So it's about finding out exactly where you're at and what your baseline is, and just trying to get a little bit stronger, a little bit more mobile, and a little bit fitter in the presence of it. And in 90+% of cases, we can manage those types of issues very well with physiotherapy. And just doing the appropriate exercises at the right level and being consistent with it.
Another question for you, nothing to do with the back, but could you please ask Johnny, are there socks available to support plantar fasciitis, and where would I get them?
There are socks that you can get. There are 2 different types. There would be socks that are designed to try and support the arch a little bit more. And you can get those in many different types of chemists and online. And then there is a different type of sock called a Strasbourg sock that basically, when you're sleeping at night, you would put on this sock, and it's almost like an attachment from your shin bone to your foot. So it kind of holds your foot or your toes closer towards your head. So in that type of position. Some patients find that gives them good relief. So basically, when you get up first thing in the morning with plantar fasciitis, the foot can feel very, very sore and stiff. And some people wear these socks. They're called Strasbourg socks, just to try and give them a little bit of relief. So those would be the 2 types of socks. You can get them in most chemists or online. And the research is kind of mixed on it. But what I would say to people is try it and see how you're going. And in most cases, even with plantar fasciitis, we know that appropriate strength work and stretches and a little bit of shockwave therapy can do the trick in most cases. Yeah.
I always associate plantar fasciitis with doing too much walking in the wrong type of shoes, and maybe shoes with a hard bottom or flat shoe. Is that the main cause?
It varies really, but with any tissue in the body, and particularly with plantar fasciitis, a lot of the time it's that the tissue's put under maybe a wee bit more stress or a different type of stress in a sudden way that it's not used to or can't tolerate, so it gets inflamed, angry, and sore. So yeah, John, wearing changing your footwear to one that's, you know, a harder footwear if you're used to very kind of softer runners can be a trigger. One of the other things that I would find is we get a lot of patients through the door that might be wearing footwear of a certain type all the time, and they go on a sun holiday for 2 weeks and wear flip-flops or sandals that, you know, have no support and are just spongy, and those that can trigger plantar fasciitis as well. Yeah.
All right then, and before I let you go, I just want to mention there's a charity cycle that's coming up this weekend. It's in Donegal Town. It's native No Barriers Foundation, and it's very accessible because it's just 8 kilometers. It's just over 8 kilometers.
Yeah, so we're kicking off. We're really excited for the No Barriers Foundation. So this is going to be over in Donegal Town on Saturday morning. Just 8K, so everybody's more than welcome. It's designed so that you don't have to be an avid cyclist. You don't even have to own a bike to take part at the minute. So we've got a couple of people helping us out here. So it's taken off from the Abbey Vocational School in Donegal Town. You can pre-register, and you can check out our Instagram and Facebook for all that information, or we'll give it to Highland Radio as well. If anyone wants it, they can be registering. So you come along at 10 o'clock in the morning over to the Abbey Vocational School. If you need to rent a bike, that's no problem. If you get in touch with John Grant Bike Mobile the day before, so on Thursday or Friday, he can have a bike sitting there ready for you. We'll have tea and coffee from Danny Gallagher. MRP is organising teas and coffees down there, complimentary. And we have another bit of sponsorship from AccuScience. I'm really excited that Noel Cunningham, Donegal Person of the Year, will be on site as well to help us there. So it's native to the No Barriers Foundation. We'll have our robotic suit over there with one of the locals, Rose McNulty, who would use the suit there in Donegal Town. She'll be demonstrating the suit. And basically it's a native neuro rehab and getting better infrastructure and facilities in the Northwest for people with brain injury, spinal injury, stroke, MS, and a lot of other things as well.
Absolutely, a fantastic cause. That's this Saturday, 10 o'clock, leaves from the vocational school, Donegal Town, just over 8K on the bike, and you're heading out towards Ballyshannon, out to the Tullyar junction, and then over to the Drumlonagher roundabout at Lidl, and then back into the town and back over to the vocational school.
Yeah, nice safe route and along the bypass, so plenty of room. Yeah,
plenty of space. Okay, then. Go to your Facebook page. Is the No Barriers Foundation Facebook page to register or for more information.
Perfect.
Thanks, Johnny. Best luck. French musical heritage through a weekend of music and events from Thursday,